Today, our presenter, Shannon Russell, will provide insights and strategies for having a successful open enrollment. She'll unveil some secrets to engaging employees effectively, optimizing communication plans, and most importantly, ensuring you don't sweat the small stuff. The recorded version of this webinar will be available following the completion of this session. You can look for a link to the recording and the slide deck for reference emailed to the email you registered with in the coming days. We would love to hear from you, but we ask that you please hold all questions for our Q&A session toward the end of this presentation. However, the chat will be open and monitored throughout this entire webinar if you need clarification. For those of you just joining, welcome. Today's webinar will be presented by Shannon Russell, Partner and Director of Employee Benefits here at Shepherd Insurance. Shannon has had 30 years of employee benefit consulting experience. Shannon uses her knowledge of employee benefits and industry trends to design custom solutions to meet client objectives and budgetary constraints. She excels in structuring plans, conducting program analysis, and leveraging resources to advise cutting-edge strategies for her clients. She began her career in employee benefits as a large group underwriter for Indiana's largest insurer and has been consulting directly with large multi-state clients since 1998. Shannon, the floor is yours.
Thank you, Mary Ashley, and hello everyone, and good morning. Always love to hear about myself, right, and how long I've been doing this. I think this month actually is my 31st year doing employee benefits, so here I am. I'm going to turn off my camera so you don't have to watch me during this, and I'll pop back on during the Q&A in order to answer any questions that you might have as we go through this presentation. So, open enrollment. You would assume that this task that we've literally been doing for decades would be a breeze and that we'd all just sail right through it without any undue stress. But these are human beings that we're dealing with, and they never cease to amaze me on their creativity. Things like why they missed open enrollment, why their mother should qualify as a dependent on the group medical plan, or their excitement at sharing with me their long list of medical conditions so that I can choose the right plan for them during an open enrollment meeting. And all while I'm patiently explaining these answers to these questions to the employees, or sometimes even the employer, I'm thinking, you know, maybe next year we should include another open enrollment closing reminder. Maybe we should include a clearer definition of what an eligible dependent is, you know, trying to learn from some of these questions that we're getting from the employees. But inevitably, these issues will be replaced next year with another set. And with 58% of employers still operating under a fully flexible or a hybrid work environment, we get a whole new set of issues and unintended consequences that no one could have ever dreamed of. So what I've gathered for you today to share are some best practices or tips that we've found while we've helped thousands of clients through open enrollment over the years. And let me start with my first tip for you right now. And that is, don't sweat the small stuff. One thing I know for sure is that something will go wrong during open enrollment. And if it doesn't, then it's a miracle and you should probably buy a lottery ticket. In fact, maybe call me and I'll buy a lottery ticket also. But my best advice to you when it comes to these inevitable issues is if it doesn't involve the 2 C's, then don't sweat it. And the 2 C's are cost and coverage. Everything else can be fixed. Just don't mess up the cost and the coverages. So let's get started with tip number 1. Mary Ashley, you can change. There you go. And let's start prepared. I recently read a SHRM article that spotlighted showing value of your employee benefit package during open enrollment. It wasn't a new article, but it had several questions to ask yourself as you kick off open enrollment planning, and several of them stuck with me. We see value in spending some time maybe thinking through these specific questions in order to get yourself prepared for open enrollment. First and foremost, what will make this year's open enrollment a success? I think this is an important question to ask before you embark really on any project that you take on. When we get to the end, when all the elections have been made, All the information's been transferred to the carriers. ID cards have been delivered to the members. What does that picture look like for you to feel like you've been successful? Try to visualize how those steps occur, and that might help make it a reality. Second, make sure that you're understanding what barriers could prevent your employees from taking action and having a successful open enrollment. Do you need to increase maybe access to kiosks or one-on-one employee meetings? Or maybe you need to focus more on automation instead of paper enrollments. Because yes, many employers are still using paper enrollments in order to collect materials. But really put yourself in the shoes of the employee and understand what barriers they might have to successful open enrollment, and try to remove as many of those as you possibly can. What might I need to do differently from last year? Did you have any what I call learning moments, moments where you thought, I got to do this different next year during open enrollment? Anything from that you need to implement this year as a change? And finally, who do I need to include in order to make sure open enrollment is a success? On average, companies dedicate about 330 hours per year to their open enrollment period. This is one of those things where it really does take a village. You'll need all the vital people like payroll, marketing, human resources, your agent, and probably even IT. But you also need to think about all the people that are involved in every stage while you're gathering options for the enrollment. Who's going to be involved in the decision making? Who's going to be involved in implementation? And make sure that you understand any barriers to meeting deadlines. You also need to make sure that vendors have been given plenty of notice for any potential change. So make sure you're gathering all those stakeholders that you need to have involved during the open enrollment to make it successful. Tip number 2 is to engage your employees. I mean, frankly, they just don't look forward to this each year any more than you do. And then we're faced with statistics like 96% of Americans don't understand basic health insurance terms like deductible, coinsurance, copay, and out-of-pocket. We've got 62% of Americans who say they don't usually change their health insurance elections because doing so is too stressful, that they might be making the wrong choice. And frankly, 50% of people would rather have their spouse have total control of the remote on Thanksgiving than go through open enrollment. So it is a very painful process for them. They don't understand everything that's happening during open enrollment. And so really making sure that they're engaged in the process is really important. Mistakes do happen during open enrollment, and they can be very costly. TIA Institute conducted a study and found that half of the people that they surveyed had opted for a health insurance plan that had higher premiums and lower deductibles, even though 99.8% of them would have saved money in a lower coverage, higher deductible plan. And that mistake cost those employees on average $1,700 a year. And that is a lot of money for a normal American. Nearly 3/4 of employees really just wish that somebody would tell them the best option for their unique situation. And so really engaging employees in a meaningful way so that they fully realize, understand their benefit options, choosing the right plan can be very important for them, even financially. Some popular engagement tools that we see used during open enrollment, paper obviously is still probably the #1 way people are communicating and trying to engage employees. That could be through benefit summary documents, checklists, emails, flyers, payroll stuffers, anything that's paper related, people are still relying heavily on. In-person meetings, whether those are group meetings, one-on-one, in-person or virtual, lots of different versions of in-person meetings continue to occur. Intranet and social media messaging. We're starting to see, most employers at this point have an intranet where they can disseminate information to their population, but we're starting to see a pickup on social media messaging as well. Text and mobile apps. This is probably the most underutilized yet employee preferred channel of communication. According to SMS Corporation, 95% of texts are read and responded to within 3 minutes of delivery. That makes text and mobile apps a perfect vehicle for very quick and pointed messaging that supports the rest of the engagement efforts that you have with your employees. Videos. Encivia reports that 1 minute of video is equal to 1.8 million words, which is probably why we've started to see videos the fastest growing method of employee engagement, particularly during an open enrollment, but not just during open enrollment. And, you know, feel free to push the boundaries here and kind of begin your video campaign months even before your open enrollment. You could start with things like healthcare literacy and change preparation, even if you don't know necessarily what's changing, but getting them involved and understanding what some of those options might be going forward. And then lastly, QR codes. You know, take advantage of QR codes on materials that you can then link the employee to see important information. Since the pandemic, we've all become very accustomed to using these codes for everything from menus at a restaurant to cashless payments. You know, these QR codes can link to any information and can appear on something, you know, as small as a business card. So please, you know, think about using QR codes. And remember to create excitement around the open enrollment. We've started to see many employers brand their benefit plan to create value. They'll engage their internal marketing team for some design guidance. They may hold benefit fairs or have giveaways leading up to and during open enrollment. And your vendor partners are a really great source for those giveaways for your employees. But this is a really important component to make sure to engage the employees. Tip number 3, create and follow a communication plan. And I want to emphasize a plan here. We don't really care whether that plan is long or short, but try to sit down and come up with a plan. Create a workflow to map or document what that employee experience is going to be so that you can better understand all the touch points and maximize the effectiveness of your open enrollment. And while employees would rather have benefits communication a few times during the year, we know that it's hard to do that. And so we still see, you know, roughly half of employers only provide education during employee open enrollment. So you've got to make sure that you've got a plan in place and you're following it. Not every document that you produce during open enrollment has to have all of the information included. Rather, the whole body of the communication pieces, when you link them together, need to tell the full story. So consider focusing each communication piece just on one particular topic to keep the information shorter and to the point and more digestible by the employees. As I said, your plan can be simple. Like there's a sample one on here that just has 7 touch points, or 5 touch points, and lasts from 7 days to 10 days prior to the last day of open enrollment. Or you can have a very complex plan. We have one in-house that's almost 150 lines long that includes everything from retirees, COBRA, remote stakeholder communication. So it can be as long or as short as you want. What I want to emphasize here is that you have some sort of plan in place so that you know when you're going to do the communications and approximately what those communications are going to contain. Tip number 4, when you're doing those communications, you want to make sure that they are clear and meaningful to your audience. So it's important for you to understand the makeup of your workforce in several different ways, along with their learning styles and their benefit enrollment needs. This could be as simple as understanding what generations are present in your group. And for a lot of you, we're up to 5 generations now that are in your workforce. We have traditionalists. Those are people that, yes, are 76 years or older. They are worried about running out of money and staying active, and so that's why they likely still work at your company if they're still there. They can eat up a large chunk of your health insurance claims if they're participating in the plan, so engagement in this group is imperative. And that should include a Medicare specialist to help explain all the benefit options that are available to this employee. While an employer can't incent an employee to leave the plan to go to Medicare, oftentimes if they just have an educated Medicare specialist sit down and compare the options to them, they'll choose to go the Medicare route and off of your plan regardless. But this is a very loyal group who does want human contact. They don't want any lecturing. They want real life examples that happen during open enrollment. Baby boomers are between 58 and 76. These are early adopters by definition, although most of that adoption was forced. So they're very resistant to change. They saw Vietnam, Woodstock, birth control, civil rights, and a giant leap for mankind. They learn the best through classroom style employee meetings, and they participate actively in those meetings, followed by a period of analysis or reflection before they'll come to a decision, which likely will be to keep exactly what they had before, but they do appreciate that classroom style employee meeting. And then we have Generation X, 42 to 57. This generation's biggest impact during our formative years, I'm in this group, was 24-hour media coverage. We got MTV, we got CNN, we got all information all the time. And so that's how we want to continue to learn. We seek multimedia or web-based training, bullet point briefs, access to an organized database where we can peruse that when we want to find information about the plan. Millennials probably is, for most of you, the largest worker segment in your population. If you look at it, those are people aged 26 to 41. This generation has most significantly seen a change in the actual rate of change. It's coming faster and faster. This is the first generation where women are outperforming men, and they've spent their whole life already feeling empowered. So you need to help them connect the dots, usually through interactive multimedia formats that are social media based. So in this instance, think instant messaging, message boards, the ability for them to be able to replay meetings online. These are the things that millennials are looking for from an education standpoint. And then finally, we have Generation Z. These folks are 10 to 25 years old. This generation prioritizes financial security over personal fulfillment, which is different than what we saw with millennials. They are the most accepting generation, and they are known as truth seekers. They view technology as a tool, but they also expect employers to use it appropriately. However, we kind of end up every 5 generations, we kind of repeat some trends. They also place high value on face-to-face interactions, similar to the traditionalists. This group of employees probably won't enroll in your medical plan. However, this group does highly value the offer. So don't skip on communicating with this growing segment of your workforce about the plans that you offer, because while they might not enroll, they will potentially stay at your organization because of what might be offered to them. So it's important really to understand your workforce and to customize your communications to meet the diversity so that you can deliver a clear message that you get heard by all generations exactly the same. The same can be said for where your employees are located. You can go to the next slide, Mary Ashley. Yep. The same can be said for where your employees are located. Here are some preferred communication methods by work location, according to Forbes Advisor. As you can see, the on-site employees would prefer to have in-person conversation, while the remote employees prefer an email. And as expected, the hybrid employees don't really know what they want. So just don't text them is all. But understanding what workforce you've got made up is also important. Also want to make sure that in your materials you call out important details, things like deadlines. You want to make sure to call out plan changes or new benefits that are being offered to the plan. Make sure that they clearly understand how to enroll and make sure that they understand what their contribution rates are going to be, including the percentage increase. I know there are some employers, I've gone through open enrollment before, where the employer doesn't want to do the math for them on what the percentage increase is. What I've found over all of these years is you're better off just being forward with it. If you try to hide what the increase percentages to the contribution rates, then it makes it seem like it's a secret, and probably gains a little bit more talk amongst the employees after the employee meeting. So don't hide what the increase is on the contribution rates. Also, make sure that you clearly have calls to action when you want the employees to do something, and then make sure that they understand who they can contact if they have any additional questions going forward. And that does kind of fit with when we survey employees, what they find most useful during open enrollment. On the next slide, Mary Ashley. 52% of them really want detailed descriptions of what's covered, closely followed by cost information and alerts from prior years. 43% of them would like examples of how somebody would use the plan. And so that's really great to do if you maybe have 2 plan options that are available or multiple plan options that are available to employees. You know, pick Sally or Joe or Mary and find some claims examples, excuse me, for those particular individuals and how each one of those employees would fare under each one of the plan options available. And then also info on how and when to enroll. So those are 6 of the things that they mostly find valuable during open enrollment. So make sure that your communications includes these as well. Tip number 5, timing is important. This is my own personal tip. Don't start open enrollment on Monday and don't close it on Friday. There's just something inevitably is going to go wrong and you're going to have to work on it over the weekend. If you try to get something going on a Monday morning and then you just have Monday and something crazy is going to happen, I would recommend starting it on a Wednesday or a Tuesday. And also don't close it on Friday, because if you close it more like on a Wednesday or a Thursday, then you've got that Friday to chase people if you are having an active enrollment. And so my recommendation is just not to start your open enrollment on Monday and don't close it on Friday. I personally like to give 2 weekends for people in order to make decisions, particularly when the employee population is highly male dominated. What we've found is in families, females are generally the ones to make health decisions. And so when you have a high male dominated population, you've got to give time for the materials to make it home. And also, if you span 2 weekends, that means you're hitting 3 weeks. If you don't start on a Monday, you're hitting 3 weeks. So the likelihood that you would find somebody who would be on vacation that whole time is pretty slim. So cover 2 weekends. And then from that point, really work backwards from known deadlines that you have that affect employees to begin your open enrollment process. So, you know, when do you want your ID cards delivered to the employees if they're getting new ID cards? That means what? That the carrier needs open enrollment by what dates? And the larger carriers will give us deadlines. I saw one yesterday from Anthem and Large Group that we needed to have changes in by November the 3rd. So you can work backwards from when the carriers need those enrollments to be in-house, which means that you've got to give yourself time to chase enrollments if you're doing an active enrollment or reconcile any statements. And so that'll give you maybe an end date for your open enrollment. So it's just easier kind of to work backwards from ID card delivery all the way through the dates on open enrollment. But I will tell you that timing is important. Along these lines, people also tend to want to do their open enrollments really, really early. As a former underwriter, I will tell you that you got to be a little bit careful there too. You know, the carriers, when they're setting the rates, are using trend at about a 7%, 7.3 to 7.5% annual trend number that's compounding monthly. So the more months that they have to trend your claims, the more likely those rates are going to be higher than what are really needed in the market. So timing is super important when it comes to your open enrollment. And my last tip, because we've been talking about this honestly since 2010, but I will tell you that there's still a lot of people that don't get it right. Don't forget PPACA. Please don't forget the ACA during your open enrollment. You know, new this year, I think it's really important to properly explain the fix of the family glitch that's happened this year. What that is that for 2024, if the least expensive family coverage employee premium is considered unaffordable to the family, then the dependents may qualify for federal subsidies for coverage that they purchased through a state exchange. In many instances, this would make the dependents coverage cheaper than through your employer plan and potentially remove some risks. This doesn't generate any penalties to the employer, so it's safe to promote this among the population. And so make sure that you're getting with your consultant or your account manager to make sure that you know how this might affect your employees and can explain that properly to them. We're still counting hours. If you're a large employer, an applicable large employer under the ACA, you have got to count hours. When it comes to determining whether you're an offering an employer, the government is going to look at anyone who hit 1,560 hours during your standard measurement period. So you've got to count the hours of the employees who work during the standard measurement period and make sure that you're offering coverage to at least 95% of those people during the new plan year. Test your plan for affordability under one of the safe harbors or for all of your employees. Penalties are not necessarily bad, but surprises are. So just make sure that you just run a quick calculation based on what you set your contributions are. We have a little calculator in-house that we can run for you to show you what level of salary the plan might be unaffordable for, just so that you can plan accordingly. Again, penalties aren't necessarily bad, but surprises are. Also confirm that your plan has a minimum central coverage and minimum value if that is your desire. Also make sure that you're continuing to offer the summary of benefits and coverage and the uniform glossary that goes along with it. And then there's other required notices that you make sure that you're continuing to provide. The notice of patient protections if your employees have to pick a primary care physician under your plan, the wellness program disclosure if you have health contingent wellness plans, CHIP notice. I think there's a new one this year, so you'd need to update the CHIP notice. Again, you only have to provide the state agencies for where you have members located. You don't have to provide all the state agency information on that CHIP notice, so you can shrink that down if you want to, but I do think there's a new notice this year, so be aware of that. The ADA notice regarding wellness programs, and then if you happen to be one of those unicorn grandfathered plans out there, there is still a grandfathered plan notice requirement. Excuse me, in addition to special enrollment notice, which I've left off here because we've been doing that one since I think 1986, but we still do have to provide a special enrollment notice as well. Hopefully you guys got some information out of those tips and tricks, best practices that can help you during open enrollment. A shameless plug for Shepherd Insurance. We have lots of employee benefit specialists dedicated to this space that can help you. Shepherd has over 40 offices. We're serving over 9,500 clients with their health insurance needs in 41 states. So Shepherd Insurance is here to assist you. And we want to do that really in a holistic way, where we can help you with all kinds of services, such as human resource services, employee engagement, compliance, strategic planning, and administrative efficiency.
Thank you so much, Shannon. We will now open the floor for questions. If you have something you would like Shannon to address, please go ahead and put those in the question box now. If we do not get to your question today, we will respond to those questions in the follow-up email. But we did go ahead and create one that we can talk about today as the other questions come in. One of the questions we had prior to the webinar was about Medicare related questions. And so one of our clients is asking that they have an eligible employee for Medicare that is eligible in March and April. How does that affect our insurance? And do they sign up for Medicare and continue to use their work health insurance, or does their work health insurance pick up certain portions?
Yeah, so depending on how many employees you have in your plan will determine whether Medicare would be primary if that employee would pick up Medicare. So if you have less than 20 employees, it is important for that employee to enroll in a Medicare plan, because the health insurance coverage is going to assume that that person has Medicare and will start to pay secondary instead of primary on that individual. So if you're under 20, it's super important for that individual to get connected with a Medicare specialist and to get enrolled in all the coverages that they need. If the employer group has more than 20 employees, then really it's at the employee's discretion. The employer cannot incent the employee to leave the employer plan and go to Medicare, but you can provide education I think I mentioned this before, but I would say 95% of the time when an employee sits down with a Medicare specialist and understands the financial and coverage options between staying with the group employer plan, moving to a Medicare Advantage plan, or moving to standard Medicare with a supplement and a prescription drug plan, understanding what all those financial and coverage options are, I would say 95% of the time they voluntarily leave the employer plan and move to a Medicare program. And so I think having them sit down and talk with a Medicare specialist is really important. Medicare works completely different than the group health plan, so there's a lot of education that needs to happen. We have a resource for that. I think we have 10 fully licensed Medicare specialists who are happy to talk with any individuals to help them understand what their options are and maybe pick the best solution going forward.
Awesome. We did get another question. So how does the enrollment process work for adding or removing dependents from my coverage? Are there any documentation requirements I have to have?
Yeah, so most of the time, an employer just requires an employee, to sign a form. As with any employment signature that you're making, you're attesting that it's the truth. And if you're lying on that form, then I'm sure there's some repercussions, just like you lied on any employee form. But generally, I would say the majority of employer groups just take the employee's word for it. Now, there is a section of employers out there that when you bring on a dependent may require proof of that particular dependent. School corporations, I know, do that. That's a state law. They have to do dependent audits. So most of them are actually requiring documentation, as well as some of the really large groups will require maybe proof of a marriage certificate if you're bringing on a spouse, or if you're bringing on a child, they might want a copy of the birth certificate showing that you're a child, or perhaps adoption or guardianship papers showing that that is a dependent. But I would say the majority of employers are still just taking the employee's word for it, and it's just a matter of signing a form, either electronically or an actual piece of paper, in order to get those dependents on or off the plan.
Thank you.
Welcome.
What are the specific dates and deadlines for the open enrollment period, and is there a grace period if I miss the deadline?
Grace periods. We had a fairly long discussion in our office yesterday, me and another employee, about exceptions. I hate exceptions. What I would rather you do. So there's two kind of deadlines here. Kind of you got to think about. There's your internal deadlines, right? So as an employer, you are going to require the employees to make an election by a certain time frame, right? What I would say is that during your planning period, while you're figuring out what those time frames are, I think that you need to build in a few days for, whoops, I missed it, I didn't realize. One thing I know is that whether you give them 2 weeks, 2 months, or 2 days, they're all going to do it in the last 2 hours. And so give yourself some grace period afterwards for those people. So maybe you set a soft deadline, I'm going to make this up, of the 10th, but in reality your real hard deadline is the 15th. Internally, I would encourage you that after your hard deadline, if someone comes in after that you don't make an exception. I think that sets you up for discrimination issues if you don't allow an exception in one situation but you do in another. And so I think it has some soft liability with regard to it. The second deadline that you have to be aware of is does the carrier have any deadlines? For example, Anthem, if you're in the small group market, they generally would tell you you can go into the system and make open enrollment changes online through the portal anywhere from 30 days before your renewal date to 30 days after. And then after 30 days past your renewal deadline, those aren't considered open enrollment changes anymore. Again, 30 days after the renewal date, to make a change on an open enrollment seems pretty lenient to me. And so I would not encourage you to allow any exceptions to those particular dates. But those are more dates for the employer as opposed to the employee. As an employer, you can set your own open enrollment deadlines to the employees, which could be and often are very different from the carrier requirements.
And then I have a follow-up question to that, and it's a little bit different, but what does active open enrollment mean? And do
Okay.
you recommend an active open
Yeah.
enrollment?
Yeah, so we usually talk about open enrollments in two ways, an active open enrollment versus a passive open enrollment. An active open enrollment is one in which the employee needs to actively make a selection, or else it is assumed that they waive. All right. Which means that every single person has to either log into the system or complete a paper that indicates what their election is, even if it's the exact same election that they have currently. For the new year, they actively have to select it, as opposed to a passive open enrollment, where we would just evergreen the elections that they made in the past year, meaning that they only need to take action if they want to change something from their current election. And I would tell you that that we still have the majority of employers doing passive open enrollments, which I think are fine if you're not making any plan changes, or there's not something that you want to take the opportunity to educate your employees about. But there are situations where active enrollments, which require everybody to make an election, are important. When you're introducing a new plan option, I think it's important then. When you need to call out something new because maybe something's changed, maybe it's not a new plan election, maybe the life insurance still continues to be one-time salary, but the carrier has changed, so there's a new EAP associated with the plan. In those situations, you might want to consider an active enrollment, just so that you're requiring the employees to engage in the process. The problem that you have with passive enrollment is that if the employees are fairly happy with the elections that they have and you do a passive enrollment, they're likely not going to engage with any of the materials that you provide, okay? From the beginning of open enrollment all the way through the end. If they're not going to change anything and you've told them that if they don't want to change anything, they don't have to do anything, then they are 100% checked out. They are not going to listen to anything that you educate them about, and they're not going to read any of the materials that you provide. So just be aware of that, but either one, active or passive, is fine, whatever works best for you.
Thank you. And we're going to do one more question. We're going to have time for that. If anyone else has any other questions, you can still put them in there, but we have one question left. Will I be notified as the employer of any changes to my insurance plan, such as modifications to benefits, coverage limits, or provider networks before those changes take effect?
So generally, you will be provided with, and I'm going to say generally, because I do find that sometimes that doesn't happen. But usually what happens when the renewal comes from the carrier, you'll get the renewal offer, and then there's usually one page in there that says, here's all the things that are changing in the certificate of coverage. So it might be things like, we're changing the number of occupational therapy visit allowances from 20 visits to 24 visits, or now this particular prosthetic device is going to be considered durable medical equipment instead of prosthesis. So little things like that are going to change in the certificate of coverage that are filed with the state, you'll normally be notified of. Other things, though, that might change that you're probably not going to be notified of are things like changes in the provider network. In all honesty, little changes you're not going to be notified of. Big changes, like a hospital system is going to drop out because there's a problem with the negotiation in that contract, you're going to know about that, not necessarily during renewal, but as it happens. The big one, though, that also changes usually in renewal that not everybody pays attention to is changes in the formulary for the prescription. And so it might be good to ask, your carrier or your consultant if there's any changes happening in the formulary and any employees that might be affected there. Those often change on January 1, and then often sometimes even 3 or 4 other times a year. But those would be when a drug would be, on the formulary, be considered a tier 2 drug, maybe, as opposed to a tier 3 drug, or maybe even move to a tier 4 drug. So you'll see those changes in the coverage of prescriptions, and that often happens at renewal too. And you probably aren't going to be notified about those either. But changes in the actual benefits that happen in the certificate of coverage, you will be notified about, but not the other two.
Thank you, Shannon. Thank you again. And thank you to all of our attendees. As I mentioned, I think that's all we have time for today. As I mentioned earlier, this recording, the slide decks we've included, and the questions will be emailed to the email you registered with. Be on the lookout for future webinars from Shepherd Insurance regarding employee benefits, commercial insurance, personal insurance, all the works. Thank you again, and have a wonderful rest of your day, everyone.